use the chat to make comments, share resources, and make connections. This is the beauty of delivering this kind of thing virtually, is that those connections can take place during the presentation. And I'll also mention that as a team, we will share presentation materials after the session. Our agenda today includes me providing a brief background and a recap of our September session. Today's session is part two of a two-part series related to lay results dissemination. So I'll give you a brief background about that. I will then turn it over to Elsa, who will give you the foundation of data walks as a way to disseminate information to the broad community. And then Sarah and Steven will speak about how they utilized data workshops and data walks in the REACH project. Our learning goals and objectives today, we want to talk about why lay dissemination is valuable, why distributing study results to the broad community is important. And in doing that, we will learn from our experts, Elsa, Sarah, and Steven, about how they developed these concepts and implemented these concepts in their projects to share information with communities in a way that is consumable and accessible and digestible. So I'll give you a brief overview of what our team did in September. Again, this is part two of a two-part series related to lay results dissemination, and particularly the importance of visual engagement for the lay audience. In our September session, we spoke specifically about utilizing lay briefs, newsletters, and infographics as methods to share information with communities. Today's presentation will be about visual engagement with the community, but we're going to focus on a very specific approach. Just dropped in the chat a little video about data walks in general. I would encourage you to take a look at that. Next slide, please, Jess. So these are some of the examples of lay dissemination visuals that can be utilized in your practice when sharing study results with communities. The top three bulleted items, the lay dissemination briefs, newsletters, and infographics, again, are the three that we discussed and presented at our September session. Jess will share the link for that particular recording. That will also be in the chat and in the follow-up materials in the event that you missed that session and would be interested in learning more about those approaches. I'll remind you that those are only a handful of approaches of many ways that you can share information with communities, which are also listed on this particular slide. But those are really common and I would say maybe really in line with a lot of folks' budgets, maybe is how I want to say it. They're budget friendly. That's the phrase I'm looking for. Budget friendly ways of sharing information. Thank you. So I'll start the foundation of today's presentation by just reminding all of the session attendees about why it's important to share research results with the community. Why is that valuable? So as listed here on the slide, it's important because we want to promote health literacy in our communities. The more communities learn and understand health information and can adjust health behaviors to live better lives, the longer that we have folks, thriving in our communities. This leads to the next bullet point, which emphasizes the importance of decision making for leaning towards information from science to help us take steps towards better health. It establishes trustworthiness in research and science, strengthens academic and community partnerships. We at Penn State in particular really are proud of some of those partnerships and relationships that we have, and we want to keep those, maintain those, and really build on them moving forward. It supports policy and funding at the state, federal, and local levels, increases research recruitment and participation, and most importantly, it empowers communities. So with that being said, and a bit of foundation laid about lay dissemination and sharing results, I would like it to turn it over to one of our guest presenters, Elsa Falkenburger. Thank you, Elsa.
Thanks, Paula. Thanks so much for having me today. I will jump right into my presentation on data workshops. We can go to the first slide. So one of the first things some of you might be noticing is that, we titled the session for today Data Workshops, but a lot of our materials say Data Walks. So the original title is Data Walks. And because of our incredible partnership with lots of folks from the disability community, we wanted to make sure that our language that we used for these materials was accessible and not exclusive of any folks. Unfortunately, the word data walk is just comes off the tongue a little bit easier, and so it's been hard to make that switch. But just so you know that that's an intentional switch in some of our language. Um, what is a data walk or a data workshop? It's really an opportunity for a community event to discuss and analyze research findings or just data that already exists in collaboration and partnership with the community. That slide that Paula just showed us talked about relationships, about partnerships, about collaboration. And so really wanting to, the who part, work with folks who are community members, people who have lived experience as co-experts, as decision makers. So again, going to that community power element, and changing that dynamic of community members being research subject, being program participants or constituents if you're doing this work in a policy arena, and really thinking about all of the layers of expertise that are necessary in order for us to do the best jobs of our work. So this image here that you're seeing is actually a photo from one of our first data walks that I was a part of here at a DC public housing site, Benning Terrace, and our partners. While you can sort of tell, you can't fully tell, but the folks who are represented here are a young person who was actually presenting back on their own data, two of the football coaches, a social service provider, a staff person from the DC Housing Authority, a trusted member of the police department. If you can go back one slide, almost there. And a parent. And actually, you can't really see, but there's actually a little kid too, because that's community and welcoming everybody to come as they are and what they need to do. And then the why, which Paula just mentioned to us again, is nothing about us without us, which is a refrain from the disability community once again, but really applies to all participatory community engaged work is we can't be doing this research without it being led by and with the folks who it's about and whose lives are at stake here. Next slide. So I just wanted to give you a quick visual. I think it's easier to take in all the details I'm about to share if you're envisioning us in a space together. So this is two different data walks that I've been a part of. The one on the right was a project around promoting adolescent sexual health and safety. And so you can see here that we're in a group. You can also see that it was the throes of COVID and trying to remain safe. And so we've got a lot on the walls here. This is more than we typically would have, but this is because this was a data workshop being conducted with the folks who did the participatory research and the programming with us. So we were deeply immersed in this work together. And we had a lot of quotes and survey data, program participant data, reflections from the service providers and from the residents. And so there's a lot of content there, but people are really looking at it really intently and discussing what it means, what's missing, and things like that. And then on the left is a data workshop that we held in Chicago that was around two generation approaches to housing supports. You can see there that we have kind of the key takeaway in that middle poster, which is like 70%. It's kind of saying what's the key takeaway that we got from this data. And then you can see the chart on the right and the discussion question there in the behind on the left, which is like, what's the prompt? What's the discussion question for this? And so basically people are broken down into groups like this and go around the room to take in different information to discuss. And if in an ideal scenario, people are really in groups where there's some level of trust. And so sometimes we would do a data walk with a select group of maybe just residents or people who are participants in something, people who are really leading the work before getting to the point that I mentioned on the first slide, which is like how rich the diversity was in terms of people's different vantage points and expertise, where you can really get into a brainstorming space with people who are normally in the um, there's a PowerPoint and a set of experts and a panel at the front of the room, and then everybody else, there's the audience, right? And so it's really breaking down that dynamic to make sure that all sources of expertise are brought together into conversation. Next slide, please. Okay, great. So you can go to the next slide. We're going to talk about individual and team prep. And I'm going to make this really short, even though it deserves to be a 2-hour presentation of its own. I think many of you who are here today probably all already know this, but are also often in positions where you need to train other team members or maybe even convince others of the why of community engagement and participatory methods. So maybe some of this will be useful to you in that frame as well. So when I use the term community engaged methods, what do I mean? I really mean recognizing and centering the expertise of people at the heart of the issue, including folks as co-experts, as partners, I mentioned, as decision makers. Doing this and really making sure that that's at the bedrock of why we're doing this work ensures or attempts to prevent potential harms. It makes sure we ask the right questions. It contributes nuance and more accurate analysis of the data, and it maximizes the mutual benefits, which are really intended to be the benefits to the community and the power for them to drive change and accomplish things in their communities. The graphic on the right shows you, one more second, sorry. The graphic on the right shows you people with lived experiences at the center, but surrounded by all kinds of other roles and identities. And this is not just to say that people with lived experience are at the center, which they are, but also to say that we have shared experiences and we have different experiences. And so somebody with lived experience is sometimes your colleague and fellow researcher. They're sometimes a practitioner or a policymaker, sometimes all four. And so it's important to not lead to another othering factor, which sometimes happens in community engagement, which is like, we're the professionals and there is the community, but that we all have these intersecting identities. Important to remember that as well. Next slide, please. And the other piece that's important in participatory work and community engagement is remembering that part of why we do this, besides the community power piece, is also because research has long been extractive and harmful to communities. And they're coming into that space with those experiences, even if they're not personal, if they're historic or part of the community that's experienced. And so how do we have a restorative process as part of the research, data workshops and other things that we're doing? We did some work to create a set of core pillars. I'm not going to go through all of them, but we have a graphic on our website that's kind of the theory of change behind community engagement. And so we follow these core pillars to ensure that we are not only not continuing the cycle of extraction, but actually investing in communities and ensuring that there's community benefit being generated. Next slide, please. Okay, this one again, I need 45 minutes for, but really quickly and maybe as a tool that you can all take and attempt. We have to do the work to think about who are we, what are we bringing, and what is our positionality as individuals, as teams, as organizations, right? So every single time I go into a community, I'm not just Elsa who means really well or has a good idea or wants to partner with you. I'm Elsa from the Urban Institute. I'm a researcher, and that is a loaded set of things to bring to people. And so making sure that my teams, and our organization in doing this work does the work to consider our different privileges, our different positionalities, experiences, resources, identities, because we bring that into the work, and that really facilitating that process with our teams is an essential part of preparing so that we can go in and ensure that we are doing a good job and not creating harm in communities as a bare minimum. Okay, that was way shorter than it needed to be, but we'll jump straight into the data workshops within the next slide. The 10,000 questions that we always get are about logistics. So I'm going to do a quick deep dive into these. The first graphic here that we have is that even though we're here today talking about dissemination and dissemination to lay communities, data workshops were designed and are intended to be done at any phase of the research process. If you start at the top, community outreach, you're doing engagement in a brand new community, you're setting an agenda, you're developing your research questions, conducting a needs assessment, and analyzing existing data or data that you may have collected with the community. Dissemination, strategic planning. And it's one of the reasons why this tool, DataWalks, is so versatile, is because it's literally for everyone, for any project at any phase. And it sometimes in certain projects that have the timeline and the resources available, often we conduct them at multiple different phases throughout the work. Next slide, please. Okay, this one's a bit of a doozy. And we will, I think, send these around later. But honestly, we have a data workshop, data walk toolkit. We have the video that was shared in the link in the chat. But I'll just walk through these briefly and then know that you have resources in your hands to walk you through this later as well. So first, in terms of planning the data workshop, make sure that you're able to clarify the goal, you're defining your key questions, and what is the purpose? Why are you conducting this in the first place? And always have a plan to share back what you learn. Even if the data walk itself is sharing the data, you're going to learn more at the data walk and the data interactive. And so think about how you're going to come back to share those things out as well. Again, thinking of this work as relational and as a relationship, you invest in that over time. And so really thinking about continually closing the loop and as a reinvestment. Spend time on outreach. This is just basic good community engagement. Get the right people in the room. How are you going to get the right people in the room? How are you going to get more than the usual suspects in the room? Engage with community leaders. Sometimes community leaders will be also gatekeepers. They're also aware of who's not likely to show up and will tell you, this is who I don't represent. Here's who's not going to show up through me. And here's who you need to talk to. But you need to ask them because they don't usually offer that up. Select meaningful data and use visuals that are in accessible formats. Think about color blindness, culturally relevant language to present at data stations. Really essential, which is why it's outlined, underlined, but should be bolded and probably in pink, is balance assets and needs. As researchers, for every proposal we've ever written, every document we've ever written always has this need statement, right? And so nobody wants to go to a meeting about their identity or their community and talk about how deficit-based and needs-oriented it is, right? So really making sure that you have a balance of assets and needs and use various data sources and data, which we'll talk about a little bit later. I think I have this different, skip one, select the station facilitator. So when possible, it's also great to not be talking to somebody about their community if you are not, do not share the identity or the community membership. And when possible, to have folks from the community actually presenting on their own data. That's not always possible, but there are different ways to incorporate different roles in there. Develop a set of materials and discussion prompts. Having a specific discussion question or a set of questions for each station is really helpful to keeping the flow going for the different stations of data. Choose a community gathering space that's familiar to participants. So a lot of times we think about accessibility. We can think about physical accessibility. We can talk about the time of day, about providing childcare and all different providing translation services. But also thinking about like, what does this space represent, right? Not everybody might be comfortable going into a university setting. A lot of times people aren't always comfortable there. So thinking about which space is going to feel safest and most set the tone for the conversation. Then when we're looking at implementation, making sure you set expectations, encourage individual reflection and facilitate group discussion. The kinds of questions that you can ask in the prompts are like, does this data seem right? Is there something missing? What story does this tell? What story does this bring up for you, right? Take the time to identify root causes and potential solutions. So not just talking about the problem, but like, where does this come from? You know, it's not, is there a systemic thing going on here always? What are the solutions? And that is the biggest one, is really ending on visioning or next step stations and commitments. People want to come out thinking about like, well, what's next? And do I have ideas about what we might want to do for this opportunity or for this issue or challenge that we're facing? Who should be involved? And then for the folks who are organizing it to be able to say, we will come back with you and follow up on these next steps. So that's the follow-up section here, which is sharing the outcomes or just basic notes. How often have you gone to something and like you take a survey, you go to a focus group, nobody ever shares that information back with you, or rarely does. And so really taking the time to say, like, here's what we heard at the Data Interactive. Here were the next steps. Here's who's in charge of that. Or saying, we acted on one of those points that you brought up, and here's what's happening, or here's what's not happening and why it's not happening, right? And then consider holding additional workshops that might bring different actors, different sectors together because sometimes somebody will hear something in a data workshop and they're actually the person who can immediately do something about it. And so that's a really incredible experience when that leads directly to action. Great. So that was a long time on that slide, and I'll fly through the next several, which are really just a variety of different visuals that give you examples for what some of these stations can include. So when you're thinking about how to create these different stations, sometimes we have so much data as researchers, and everybody's been the person to edit that report where you're like, I know you painstakingly collected all this data, but it doesn't all need to be in here. And in fact, it will be much less effective if you include all of it. So taking the time, again, bring community members in to decide what is it that we're trying to do with this data interactive, which data are we going to discuss, what are the goals for the community input or discussion or feedback, what information is most important, what data do you most need the context or community stories about, and which data might prompt some next steps and follow up. Next slide. This is a mural actually from my community that says community everything, which I did not spray paint myself, but I kind of wish I had. So you can really even bring up something as like an icebreaker or warm up as an image from if you have a geographically based community, something that people are immediately going to have in a reaction and be like, yeah, that's on the wall from my hospital, and this is what that hospital means, or it really gets people feeling like, oh, is that a data point? I can talk about that. It's a much easier thing to start with. So we do things like that or other visuals that might be important to people, mapping exercises, charts and visual data that we'll show in a second, even quotes from interviews or focus groups, newspaper headlines and articles, and then the visioning exercise can look like a lot of different things. So I'll show a few examples of these in the next few slides. Okay, it's a map. It has a variety of different percentages on it, but basically this is something that you'd be able to walk people through. What are the different shading means? What are we trying to discuss here? The next slide is another map where the intention is to be a little bit more interactive. So there's a lot of different polka dots on here. The dots might mean different things. You might even give people stickers and have people place stickers on the map and label things that are of importance to them or a challenge to them or something. I would really like to see a grocery store here. And so you can make the mapping exercises an interactive station as well. Next slide, please. These are quotes from different focus groups, which just to show you how sometimes people really want to interact with words, or there's something that you can convey through a quote that's not your own or through a specific data point. So always including that kind of qualitative element can be helpful. Next slide, please. And then this is to show that, and the next slide as well, is to show that there's like a lot of different ways to represent things. So we can have the qualitative element in quotes. You can have percentages that are labeled by place on the left here. You can have a bar chart, which actually shows the same data as is on the left. On the right, I didn't have time to do a data viz, so I just stole this picture from Shutterstock, but it's something that I think was from one of your previous presentations, right? We could also have this data represented in more of a data viz, like 1 in 10 people, those kinds of numbers. And then the next slide, sometimes just break it down for people. What are you trying to tell me in that chart, right? Like we're trying to tell you 74% of food insecure Perry County residents are eligible for SNAP benefits. So some people do better with just like the key takeaway. And it's not saying, you're not telling people you need to believe this or this is right or wrong, right? You're just saying this is what we got out of this, the team of folks who presented, who created this today. And so sometimes just breaking it down and writing what your key takeaway was is helpful for people as well. And then last slide for me. Like I mentioned, two of the most important things are kind of the visioning station at the end and the debrief or the harvesting of ideas. And so taking the time to brainstorm about what are the key takeaways from today? Are there next steps? Are there suggestions? Who is going to be responsible for some of these? And then the debriefing and harvesting like in groups to also be able to say, okay, do we want to prioritize? We had a lot of ideas, but what are we starting with? And for if there's different groups who want to share out with each other or do a readout of the different comments, sometimes we do post-it notes that get left behind in the different stations so that if not everybody feels comfortable or has the time to speak out loud, they're able to do post-it notes. And so being able to basically harvest all of that information and bring it back to the full group to be able to have a full group discussion and identify those next steps. Excellent. Thank you. Sorry for speaking at you so quickly.
Thank you so much, Elsa. Wow, what rich information. There are so many things that I have taken away from what you were talking about, but a few things in particular that stood out for me is just the variety of ways that you shared the information within the data walk itself. So the different visuals that you're using, different things appeal to different people as far as how that information is presented. Like you were saying, a pie chart, uh, a bar graph, just a big number, or maybe a quote from someone that was part of the process. So that stood out to me, and making sure that the information you present is a balance between assets and deficits. Yeah, I think that those are really important takeaways for me personally. I'm sure folks on the call have a lot of other things to say. Um, I'll mention that Elsa is in demand. So she is transitioning straight from our meeting to a meeting that she has to attend at 2 o'clock. So while we're leaving time at the end of the presentation for questions, if you have something that's top of mind that you'd like to ask Elsa, perhaps you can drop it in the chat now so that you don't risk her leaving before you can ask that question at the end of the presentation. We'll also share Elsa's email in the event that you want to email her directly rather than putting it in the chat. So thank you so much, Elsa. And at this point, I'll turn it over to Sarah and Steven, who will share a little bit about how they use this approach with the REACH project. So thank you.
All right, so hello everyone. My name is Steven Negron-Candelario. I'm the program director for the Racial and Ethnic Approaches to Community Health, also known as REACH. And today we're going to be talking to you a little bit about late result dissemination and sharing research findings through data walks. And just a quick overview, we're going to be talking a little bit about the REACH program and what it entails, talking to you about our needs assessment and how we collected the data for the data walk, the process itself of the data walk, and the evaluation and outcomes that we reached. And so I mentioned REACH stands for Racial and Ethnic Approaches to Community Health, and the goal of REACH is to improve health, prevent chronic diseases, and reduce health disparities among racial and ethnic populations with the highest risk or burden of chronic disease. So REACH funds 50 organizations across 32 states, and ours is one of two recipients here in Pennsylvania, with the other one being in Allegheny County. Our program focuses on 4 counties, York, Dauphin, Lebanon, and Berks. And we are focused on improving the health and wellness of the Hispanic and Latino community here in central Pennsylvania. As some of you may know, Pennsylvania ranks number 13 in the nation in terms of total Hispanic Latino population. And so a significant number of our community members identify as Hispanic and Latino. Our work is guided by a comprehensive community needs assessment, which we'll be talking a bit more about. And we focus on different strategy areas when it comes to health. We work in nutrition, where we tackle things like produce prescription programs, food access, food service guidelines. We work in physical activity, where we look a little bit at the built environment and how that affects people's ability to stay mobile, in their day-to-day life. We work in early care and education, where our focus is on home-based childcare providers. And we also work in adult and child vaccination. And so we kick off our work in year 1 by conducting a community health needs assessment. We did our community health needs assessment in partnership with Franklin and Marshall College Center for Opinion Research. This was conducted in 2023, which was year 1 of our REACH grant across all 4 of our counties. Our needs assessment consisted of a 20-minute phone or online interview with questions across 4 different strategy areas. And we managed to get a total of 660 households who completed the survey. After we completed the survey, we did a few different analysis, including county level frequency and crosstab reports that helped to sort of guide the information that we shared at our data walk session. And I will turn it over to my lovely colleague, Sarah, who's going to talk a little bit more about the data walk itself.
Yeah, thanks, Stephen. So I'll be talking today about the actual process of putting our data walk together, how the data was selected, how we put together the materials, and then I'll touch on evaluation and outcomes at the end. So picking up where Stephen left off, we had this robust needs assessment data, and we really wanted to share it back with the community and collaboratively discuss community program ideas going forward, which would help shape the next 4 years of action items under our REACH programming. So our data walk was held at the Better Together Health Summit in October 2024. This event is hosted annually by the Lebanon Community Health Council. We've been working with them for several years, and Lebanon was a key catchment county in data collection. The Health Summit itself was held at City Hall in downtown Lebanon City, and attendees were about 100 local leaders, staff, and volunteers from organizations across Lebanon County, many being health and service providers. So the Health Summit is an all-day event with many organizations sharing data ideas throughout the day. So we thought it was a really great opportunity to think outside the box and utilize a data walk to share our data. Next slide. For our data selection, the REACH faculty and staff led data discussions in each of our key strategy areas, which again are nutrition security, physical activity, early care and education, and adult vaccination regarding what to include in the materials. Ultimately, these discussions resulted in 3 key actions. For each of the strategy areas, we selected key data points that would facilitate dialogue. We grouped related data to form focused and digestible discussion topics, and we prioritized a few relevant data points rather than an exhaustive community profile, and we did this to enhance engagement. For our messaging, kind of as Elsa touched on earlier in her presentation, we really focused on the messaging being positive and really designed to generate excitement and not focusing or getting stuck in problems. Next slide. So for our data walk materials, when we were envisioning our data walk, our goal was to have a really immersive experience. So the materials that we ended up designing included 6-foot banner ups, and these provided the program-specific data clusters from each of our strategy areas for discussion. We also created and designed 3-foot by 3-foot floor stickers, which were home to conversational singular data points from the needs assessment. And then we had a second series of stickers honoring Hispanic Heritage Month and elevating our respondent voices. So you can see in the upper right-hand corner of your screen a picture of the banner ups, and then to the left of your screen a picture of the floor stickers. So at the City Hall was the location of the data walk. So when you walked in, the banner ups were set up in pairings of 2 or 3 throughout that first floor of City Hall, along with the data walk stickers. And throughout the day, we had facilitators near each set of banner ups to ask and answer questions and help engage in discussion with the attendees walking through. Next slide. Yep. So I'm going to talk for a few slides just about the design and approach to the banner ups. So these were, so we had 7 total banner ups and they were 6 feet tall. So that is a lot of space. So for the creation of the banner ups, we did work with a local graphic design company who's been a really great long-term partner of the REACH program. And they provided the following really helpful guidance for the design. So each banner up had a total of 3 to 4 design blocks, and each individual design block could include data, text, mapping, graphics, charts and graphs, or data visualizations. And we really worked and tested all the final text that was included to ensure that it was at an 8th grade or lower reading level. Oh, I'm sorry, could you go back one? And then on this slide, you can see the first two of our banner ups. The one on the left is just an overview of the REACH program for any attendees who may not have been familiar with the program. And then on the right, we did have a banner up kind of talking about why needs assessments are important and the process of how we conducted ours. Okay, next slide. All right, so you can see here our two nutrition security banner ups. If you look at the one on the left first, it's titled Food Service Guidelines. This banner up had 4 different design blocks. You can see those all organized and numbered below. And this one focused on key data that really highlighted strong community beliefs in the importance of eating fruits and vegetables. We also clustered data that showed low utilization of fast food and most meals being cooked at home. And then we paired that with data that, given all of this, still about less than half believed that they were eating enough healthy foods and fruits and vegetables. And then if you take a look at the banner up on the right for Nutrition Incentive Program, this banner up utilized 3 design blocks, and it focused on data around strong community beliefs around access to nutrition and nutrition programs. And we paired that with data showing somewhat low awareness of many of these programs that were available in the community. So in both of the banner ups, you can see we had digestible data and simple findings that were able to generate conversations. We utilized data visualizations. Again, those data summary points, like what the main takeaway of the chart or graph would have been here. Okay, next slide. And then here are our banner ups for physical activity and early childhood education. We'll start with the one on the left for physical activity. This one really focused and shared data showing strong support for increasing opportunities for physical activity across the county. And then we paired this with data that showed a really strong baseline in participation in physical activity and exercise over the past 30 days. So this was really great, baseline data. And so we grouped this data with opportunities across the county to increase advertisement and promotion for physical activity, as well as who the trusted community sources are to provide that type of information. And then the EC banner up on the right is a little different. For this one, we provided density mapping of local ECE centers and then paired it and shared key data around strong community agreement around following healthy food guidelines in ECE programs. And we also paired it with opportunities to increase ECE participation in federally funded programs that help increase access to nutritious meals for children in ECE settings. So again, in both of these, a very simple presentation, digestible data, and needs assessment findings that were able to generate discussion. Next slide. Here you can see some photographs from our data walk event. You can see participants walking through the different banner up stations, engaging in conversation with people they were walking through, as well as interacting with the facilitators that we had at each one. And you can also get a sense here again, just of the scale of the materials and also the vibrancy of, the design. Again, all designed really to elicit, really positive and excited conversation. Next slide. So I'm going to move from the banner ups over to the floor stickers. So for the design of the floor stickers, we really worked to have one data point and message per sticker. Each of our strategy areas was able to design 2 messages for these. And again, the data that we selected was really done so to facilitate attendee discussion. Next slide. And you can see here a little more clearly the data points and messages that were shared across each strategy area. We had 2 for physical activity, 2 for nutrition, 2 for early care and education, and 2 for adult vaccination. This is a picture of our REACH team and our CDC program officer team. And you can kind of get a sense here of just the scale of the floor stickers. If you look at the one on the left-hand side of your screen, we could actually fit 2 to 3 adults within each floor sticker. So we actually had attendees literally walking on and through data at our data walk. And we got a lot of positive reactions to the floor stickers. Next slide. And then this is our second series of stickers honoring Hispanic Heritage Month, which coincided with our event. And we did design, we had a custom design and a custom logo for these. And the data that we selected was really meant to uplift the voices of our respondents. And we utilized the Did You Know format for some of those. So if we move to the next slide, you can see some examples of the data and the messaging that was included on these Hispanic Heritage Month stickers. The first one on the far left is for our physical activity area, and it says the Hispanic and Latino population in Lebanon prefer biking to get to their everyday destinations. And then the one in the center is aligned with our nutrition strategies, and it says, did you know that the top 3 preferred fruits and vegetables of the Hispanic and Latino community are tomatoes, corn, and onions, and then lime, pineapple, and avocado? And I'll circle back to these when we get to outcomes and next steps. Okay, so we can go ahead to the next slide. So we did evaluate our data walk and the data walk materials. I think this could be its own presentation, but I'll just focus on a few key things. So this effort was led by our REACH program evaluator, Dr. Nirmal Ahuja, and he, along with a group of students from his biobehavioral health class at Penn State Harrisburg, which is one of our Commonwealth campuses, they developed and administered the evaluation. So the evaluation was conducted in person, and it was a series of 4 questions that was asked across each of our 4 strategy areas, materials, and then there was some open discussion and dialogue at the end. So we have some pretty robust findings. I'll just focus on a few here that align with the materials. Overall, the evaluation showed that the community really liked the clarity, visual appeal, and organization of the data displays. They found that it made complex information easier to understand, and it also revealed important community health priorities and challenges. Specifically for nutrition security, there was surprise in the disconnect between the available resources and community awareness, and this prompted calls for expanded outreach and education efforts. For physical activities specifically, participants were surprised by the strong demand and enthusiasm for physical activity opportunities, which contrasted with some lacking infrastructure and program offerings. And then many attendees were very open about sharing how they were planning to use the data in their own work and volunteer opportunities. These mainly centered around bridging communication gaps, informing program advertising strategies to improve visibility and participation, and plans to directly ask residents and involve them about their needs and preferences. Okay, next slide. So when we're looking at outcomes, our data walk took place 1 year ago now, and in the time since, we've onboarded new community partners in ECE and nutrition. These are organizations that serve the Lebanon community. We've seen an increase in cross-strategy collaboration. Several of our programmatic initiatives now span 2 or 3 strategy areas rather than focusing on just one. So we've seen a decrease in the silos of our work and the way we interact with our partners and having more collaborative partner efforts in the community. Additionally, the materials have served as a blueprint for program data dissemination in other counties and events. And for next steps, we are in the process of submitting a manuscript that details our data walk process, evaluation, and findings. And I just wanted to circle back quickly to that cross-strategy collaboration. If we think back to the messages that were included in the Hispanic Heritage Month stickers, the preference for biking as a means for getting around in the community and the preferred foods. A lot of the work in our communities that we do with our partners are really focusing now on expanding and making safer bike routes and working with our food providers to ensure that culturally preferred and requested foods are available to the community. So with that, I'm going to hand it back over to Paula.
Thank you so much to Sarah and Steven for that great presentation about how you implemented some of these techniques to share the information about the REACH program and get feedback from the community. I so appreciate your presentation. Thank you. So we're at the point where we can field some questions, and I do see a few that have come through the Q&A feature. And this is this is happening in more than one spot, and folks are asking about, no surprise, budget. So the question is 2 different questions, but it's in the same topic. How did you fund this work? Did you write it into your grant application? Or idea of a budget for an event? I know this varies a lot, but even ballpark figures might help us to encourage study teams to considering having such an event. They're curious about how that happened.
Yeah, I'm happy to start answering that, and then Stephen, he can pop in if he has anything additional to add. So we did include this in our initial grant application. Our REACH program is funded by the CDC. So, with the CDC grant, our first year is always, baseline data and collecting needs assessment, and then that informs our activity and implementation strategies over the next 3 to 4 years. And then we do a reassessment at the end in the 5th year of the project. So data collection, data tracking, data sharing with the community was already kind of mandated in our grant. And so, that was already included. We knew we were, data and data sharing was part of our budget. For cost estimates, honestly, you could plan an event for as little as, 2,000 or 2,500, and you could probably, if you wanted to, go up to 10, 15, $20,000. But I think we've worked with a lot of partners who host these summits and do these events for under $2,000. So ours wasn't in the higher range, but we did already have that planned into our budget. But I would just emphasize, these don't have to be really expensive events. You can do these. You can print out your own materials. I know universities have print shops, and Elsa showed great examples of just kind of printing out like findings and questions and putting them on the wall and using Post-it notes. So, you don't have to create big banner ups or, print out and design floor stickers for every event. I don't know, Stephen, do you have anything to add?
Yeah, the only other thing that I would touch on is our team is lucky enough that we have people that speak different languages, and so we're able to get some of those materials translated in-house. But one thing to consider when you're trying to develop culturally appropriate, dissemination materials is if you don't have that capacity on your team, one thing you might want to consider is also including the translation services and fees that would come with something when it comes to advertising to different communities. But
And I definitely do not recommend trying to do interpretation, like it doubles the time of your event. And I had to do it once because they didn't realize that there was going to be a whole group of only Spanish speakers. And so we suddenly, thankfully, had two staff members, including me, that were Spanish speakers. And so not only did we have to like pull that off on a dime, but it doubled the time of everything and the debriefs and things like that. So essential that you have the materials in the language and have that planned separately.
Thank you. I'm just turning to another question in the Q&A feature. What have you found challenging with data workshops? What's been tricky or has not gone how you wished it would? So maybe some pain points. Or everything was completely successful and went as
Never.
exactly
There's
as
always a
planned.
challenge. I'll just give a few without getting into the deep feelings of all of it. But, I just mentioned one, showing up and realizing that we needed everything in a different language. Not having, if you are going to pay participants and community members for their time, which I highly recommend, we hadn't capped the event at a certain amount, and then a ton of people showed up. This was in New York City. We didn't have enough incentives. I went to the ATM and got more money because I was not about to send anybody away. And, so that's kind of like logistical challenges. And then the other one, which I stressed, and I think we all stressed, was like one of the first data walks I did, we had a lot of deficit-based data. The researchers were presenting to community members about their own experiences in their community. Never did that again. So there's always a lesson learned, but I will say that nobody, I've been supporting others in doing data interactives and data walks for a long time now, and nobody has ever come back to me and said, like, I wish we hadn't done that, or we should have done something entirely differently. So even when there are challenges, we just lessons learned and loop it into the next effort.
Awesome, thank you. There are a few more questions. I'm trying to get to all of them, but I also recognize we have 2 minutes. So one of the questions in the Q&A is, have you adapted data workshops into digital asynchronous spaces, or does it require the in-person interaction? That's a great question.
Yep, we've done a lot of both virtual and asynchronous. There's actually another video if you Googled data walk virtual, I think that might come up. So we've used Zoom just like this. We would send people to breakout groups. There's a lot of different ways to go about it, whether you present data in the main room and then send people to breakout rooms to discuss, or if you have people rotate through different breakout rooms to discuss the different content. We do a lot of, if you look I don't know if it's available today, but yeah, Zoom offers a whiteboard of its own now. So you just click on whiteboard in the bottom right-hand corner and it pops up, and people can put post-it notes up and share that way. And we've also done asynchronous in collaborations with community-based organizations, where, especially when you have such gorgeous materials as what Sarah and Steven just showed us, I'm like ashamed. I don't think we've ever had anything that looked that nice. But something that you can leave behind, and people can comment, whether it's speaking to a person who's on site there and regularly there, or leaving behind post-it notes, or there's different kind of materials that you can leave behind for people to interact with if there's like an interactive station like the map or something like that. And so people, especially if there's like a place-based, meet people where they're at. If people are regularly coming through a space, a library, a center of some kind, people can interact and engage. Obviously, you're missing the dialogue, which is a really rich part of it, but at least you're able to share the data back and gather some additional information and get input from people.
Perfect. Thank you so much. I think I want to just be mindful of the time here. I do see a couple of additional questions in the chat. But I do want to wrap it up for those of you who need to get on to your next thing. I'll just share with you the next slide, if you would, please, Jess. So there are some resources. Again, this slide deck will be sent to all participants, so you can have this at your fingertips. And then the next slide, please. Jess is going to put in the chat a little Zoom poll, whether or not you would consider using data walks moving forward in sharing results, or as Elsa mentioned, this approach can be used throughout the research life cycle. So perhaps you would entertain that for other points in your programming. Elsa, thank you so much. Good luck in your next meeting. So yeah, Elsa shared her email and she's happy to field some questions by email. So it looks like we have a good response for folks who would consider using data walks for sharing study results moving forward. I'm guessing that the folks who said maybe are perhaps pausing because of funding, right? It does cost some money. As Sarah and Steven mentioned, you could probably do it in a way that's budget friendly, or you could really do it in a way that that's quite, you know, dramatic, I guess I want to say. But either way, the idea is to get that information in the hands of the community. So I appreciate all of you taking your time to be with us today and learn about this really awesome approach to getting into the community and sharing the results. Keep an eye out for future educational sessions that our team will be offering in the spring. You're welcome to reach out to us at this email, the CTSI Engage email, with any additional questions. And thank you so much. I have a great afternoon.